Mary. How are you doing? Hi, Mary. This is Tiffany. She's going to be your nurse tonight. I'm just going to give her a report. Is it okay if we do that in the room? All right. So I'm just going to check my pal here and make sure that I have no new orders and no overdue tasks. So we are good there. And we have Mary Ham. She is a 78-year-old patient of Dr. Jones. She's a full code. She has allergies to grapefruit, but no known medical allergies. She was admitted today, and if I hover over this in a real patient, it'll tell me the diagnosis. So she had a left total knee done today. She has a history of, we'll go to our SBAR page. She has a history of AFib, anemia. She's had an appy in the past, as well as sleep apnea. She is a non-compliant with her sleep apnea, so she does have capnography hooked up. Her surgical history, this fake patient has a lot of medical history, so we're just gonna skip through that. She is a type 2 diabetic. And then we have our surgical history down here. Again, we're just gonna go over a couple of these things. Appendectomy, like I said, and angioplasty. And she's had the other knee, the right knee replaced in the past as well, over a year ago. The patient got to 5:50 in her current bed around 8 o'clock this morning. She hasn't, if the patient had been in any other area, we would see that here. Let's see here. Our clinical details, we would see our diet here because it's the fake patient. We don't have that information, but the patient is on a 3 to 4 carb diet, can ambulate as tolerated, has been up with therapy a couple of times, up with the assist of one in the walker. I have no overdue tasks here. Contact information, we should have a password listed for every patient, so that can be found here. Otherwise, Anne, her daughter, is the contact, and her phone number is 555. And then we'll go to our physical assessment here. So vitals, temperature 98.4, heart rate's 80. She does have a history of hypertension. This morning, blood pressure was 154 over 74, but after she received her morning medications, it came down to 132 over 68. Has been on room air with no issues with that. Her CO2 has been good on the capnography as well. She is not a daily weight. She does have fall precautions, so she does have the bed alarm on. Patient assessment. Again, the contact is Anne, her daughter. Pain has been anywhere from a 3 to a 5. She does get scheduled oxycodone for that, and the next dose will be around 9 p.m. So the pain is in that surgical knee on the left side. She just says it's kind of aching, but the medication does help with that. She has appropriate speech. She's alert and oriented ×4. Denies difficulty breathing. Lungs were clear. No cough. Denies lightheadedness or dizziness when she's ambulating. Good cap refill. Heart is regular. She does have some edema to that left lower leg, but it is non-pitting. No complaints with her bowels. She had a bowel movement last 2 days ago, so I did give her some milk and magnesia for that. She is passing gas. She denies problems urinating, has been up to the bathroom a few times. Bladder scanned her after the first time and it was less than 100, so per protocol we did not repeat that. She's voided since. Pain to that left knee. Did my 4-eye skin assessment earlier. She just has some bruising on her right arm, and then her Aquacel dressing on her left knee is clean, dry, and intact. Her labs, the only thing she has for labs are her blood sugars. They have all been less than 150, so she has not needed any low dose correction. She has that ordered before meals and bedtime. Everything has been good with her oxygen saturation on room air, and her CO2 has been good on the capnography. She has a right hand 18 gauge IV that has normal saline running at 100 an hour. She's been drinking well. She's got fresh water there, and like I said, she's voiding well. Recommendation, she does have her incentive barometer at the bedside. She has SCDs on. Aquacell will stay on for 7 days from today, and plan is for her to go home tomorrow pending therapy. Here I would be able to see my med times to give to Tiffany and my continuous infusion, as well as any PRN medications or any pain response tasks that were not completed. Do you have any questions, Tiffany?
I don't think so. I think we're just gonna look at the IV line here. Looks like there's a 20 gauge in that right arm. Patient has SCDs on, Aquacell dressing, and capnography is on. Looks good. Gonna update the whiteboard with my name and who I'm working with today. Okay. All right, Mary. Brittany's gonna go home and get some sleep, so I will see you after bed, okay?
Do you have any questions for me, Mary, before I go, or anything I can get you right now? Okay, have a good night. All right, so now I gave a report to Tiffany. I'm gonna go to ad hoc. I'm gonna go to my handoff form and type in her name. And there we are, and save, and all done.